In Canada, public health insurance is available to eligible residents. Canadian citizens and permanent residents can apply for provincial health insurance. When living in Canada, you are not covered by a federal health program. Each province and Canadian territory operate their own provincial health system that is funded by the provincial and federal governments. Coverage can be different from province to province. Although each program covers certain programs or procedures, you cannot hop from province to province. There are requirements that must be met to acquire coverage. In this video, we will cover the Nova Scotia healthcare system. What is MSI? MSI stands for the Medical Services Insurance Programs. They are administered by Medavie Blue Cross on behalf of the Nova Scotia government. The Department of Health and Wellness provides policy direction for the programs. The Hospital Insurance Program is administered directly by the Department of Health and Wellness. The cost of providing these services to Nova Scotians is met through the general revenues of the province. You pay no premiums. To be eligible for Nova Scotia medical service insurance benefits, you must be a Canadian citizen or permanent resident, landed immigrant, a resident who makes his/her permanent home in Nova Scotia, present in the province 183 days every calendar year, and registered with MSI. The following individuals are not eligible for coverage. Members of the Canadian Armed Forces. However, family members are eligible. Tourists and visitors to the province. Students from another province and inmates of federal penitentiaries. Please refer to the section moving to Nova Scotia from outside Canada if you are a non-Canadian. If you are a full-time student from another Canadian province, you are not eligible for MSI coverage. Your home province will continue to provide coverage as long as you are a student. Contact your home province to ensure your coverage is maintained. Proof of citizenship or immigration status is required for the application process. How to get MSI health cards. To register for a health card in Nova Scotia, you must contact the MSI Registration and Inquiry Department at 902-496-7008 or at 1-800-563-8880, toll-free within Canada, to start the application process. Blank applications are not provided. Applications are assessed on an individual basis and proof of citizenship or immigration documentation is required. Once the application is processed, health cards are issued for each family member. Health cards must be presented to healthcare providers before receiving insured health services. A list of acceptable documents for proof of Canadian citizenship. Canadian birth certificate. Valid Canadian passport, or one that has not been expired for more than 5 years. Canadian citizenship card or certificate, both sides. Nexus card. Registration of birth abroad. Baptismal certificate which states when and where in Canada the person was born. Canadian military ID, RCMP ID card. Proof of Canadian Old Age Security, OAS. Proof of date of birth will also need to accompany this. Certificate of Indian Status Card. What's covered? The Nova Scotia MSI program is a federal health coverage program designed to supply all eligible Nova Scotia residents with free, fundamental medical benefits. Once you become a registered Nova Scotia health cardholder, the MSI program will provide basic healthcare services, emergency room visits, doctor's office visits, and medically required hospital stays. Dental care, yearly checkups, cleanings and fillings, as well as standard dental services for children under the age of 14. Physiotherapy if deemed medically necessary and if occurs in a hospital setting. Vision care, one visit to the optometrist every 2 years for those younger than 9 and older than 65 years of age. Standard hospital ward rooms. Home care coverage only if you qualify. What is not covered? Ambulance services, with the exception of transportation between medical facilities, for example hospitals. Routine dental services, for example cleanings, fillings, scalings, etc., with the exception of people under the age of 14. Prescription medications if you are under the age of 65. There are prescription drug programs that you may qualify for. See below for more information. Paramedical services such as podiatrists, chiropractors, naturopaths, massage therapists, osteopaths, and physiotherapy. There is very limited medical coverage for Nova Scotians traveling out of province. Vision care, for example glasses, contact lenses, and eye examinations for residents aged 10 to 64. Durable medical equipment such as crutches or wheelchairs. Note, there is an assistive devices program for children that is run by the Abilities Foundation of Nova Scotia Hearing Aids. Note that there are exceptions, for example the First Nations and Inuit Health Branch, or FNIHB. Difference in cost between standard hospital rooms and semi-private and private rooms. Cosmetic surgeries. Nova Scotia MSI out-of-province coverage. As of August 1, 2014, Nova Scotia residents are permitted out of the province for vacation by 1 additional month. This will allow Nova Scotians to have a vacation outside of the province for 7 months in each calendar year and continue to be eligible for medical services insurance. Vacationers are required to inform MSI of their absence by telephoning 9024967008 local or 1-800-5638-880 toll-free in Canada, or submitting an email to msi@medavi.ca. If you have moved to Nova Scotia from outside Canada, you will not be eligible for a temporary absence until you have resided in Nova Scotia for 90 days before you would be entitled to an absence up to 6 months, or for 183 days before you would be entitled to an extended absence. If you will be temporarily absent from the province for more than 3 months, short-term absences under 30 days are not monitored. You should contact the MSI registration department at 9024967008 or 1-800-5638-880 toll-free in Canada, or msi@medavi.ca advising the date you intend to leave Nova Scotia, the reason for your absence, your intended return date. However, if your eligibility is in question, the Department of Health and Wellness/MSI have the authority to review total absences from Nova Scotia and request a residency declaration to be completed. If you are traveling within Canada, all provinces have signed an interprovincial reciprocal billing agreement, except Quebec for physician services. If you show your current provincial health card to the provider for medically necessary insured services, the claims will be paid by the host province. They will be reimbursed by your home province. If you are required to pay the attending physician, please submit your itemized receipt to MSI for consideration. Travel outside of Canada. If you are traveling outside Canada for a short period of time, MSI will provide coverage for emergency medical services. 1. Out-of-country inpatient hospitalization as the result of an accident or sudden illness, while temporarily absent from Canada, is covered in Canadian funds. The current rate for emergency inpatient services is $525 Canadian per day plus 50% of ancillary fees incurred while an inpatient. Physician services as the result of an accident or sudden illness during a temporary absence from Canada are covered in Canadian funds at Nova Scotia rates. 2. The following services are not payable under the MSI program: facility and hospital outpatient charges, X-ray, diagnostic tests, and laboratory charges from outpatient, emergency, or private facility, Pharmacare and children's dental programs, routine vision analysis. The balance of an account after payment by the department may be quite large. It is strongly recommended that any resident traveling out of province purchase a travel health plan for the period of absences to cover these balances and other insured services. Ambulance services rendered outside Nova Scotia are not subsidized and are therefore the patient's responsibility. All claims must be received by the department/MSI for payment within 6 months of the date of the discharge from the hospital to be eligible for payment. No claims received after the lapse of 6 months will be considered. All physician claims should be sent to P.O. Box 500, Halifax, Nova Scotia B3J2S1. Any questions, please contact MSI. Seniors Pharmacare. All permanent residents of Nova Scotia who are 65 and older, have no other private or public drug coverage, and have a valid health card are eligible. Designed for elderly residents with no drug coverage or high drug costs. New international students. As a new international student, you are not covered under Nova Scotia's health insurance, also known as MSI or any other provincial plan. This means that you must purchase an international student's emergency medical insurance plan provided through the college and in partnership with our outside service provider. Students from another Canadian province. If you are a full-time student from another Canadian province, you are not eligible for MSI coverage. Your home province will continue to provide coverage as long as you are a student. Contact your home province to ensure your coverage is maintained. This concludes our video on the MSI health insurance card in Nova Scotia. If you are planning to move to Nova Scotia and require insurance coverage until your provincial coverage begins, be sure to check out insurednary.ca.